Good morning, good afternoon, good evening, wherever you listen to me. This Romeo Gamet once again coming your way. I want us to talk about a simple condition today called periodontitis. Periodontitis, one way or the other, we can also call it gum disease, or we can also say gingivitis. Periodontitis, to say, is a serious gum infection or inflammation of the gum and the supporting structure of the teeth. Okay. Um, Talking about the gingivitis, periodontitis, gum disease, it is usually caused by poor oral hygiene. When I talk about poor oral hygiene, what I mean here is that sometimes we eat a lot of sugary food, we eat meat, we eat some fibers, and then we leave the pieces of these items in the teeth. Naturally, the mouth, there's some amount of bacteria in the mouth that are not harmful to us one way or the other. But our activities during the days may increase their reactions. Let's say after eating and you left the pieces of meat or whatever in the mouth without brushing your teeth and you sleep with it, it may increase the risk. Okay, so here the periodontitis here I'm talking about is talking about gum disease or inflammation of what the structure of the teeth. Okay, I want us to talk about one or two symptoms. Maybe one way or the other, this thing is happening to you, but you don't know. It's a serious disease of what the supporting structure of the teeth. Okay, firstly, you may experience something like swelling gum, the swelling gum or edema of the gum. In your gum, the supporting structure of the teeth may swelling or edema. You may see this kind of swelling gum. As time goes on, you may experience something like tender gum when touched. When you touch your gum, you feel like it is tender. It may be a symptoms of periodontitis. We can also see profuse bleeding. Profuse bleeding. Sometimes when you brush your teeth, or you may see bleeding from the gum. It's a sign of periodontitis. Spitting out blood when brushing your teeth is also a sign or symptoms of periodontitis. Sometimes when you brush, most at times when you brush our teeth, then you spit out the paste or the saliva, you will see that there's traces of blood in it. Yes, if every day you brush your teeth and you see traces of blood in your saliva, it's a sign of periodontitis. You have to do something about it. We can also talk about bad breath. Bad breath, the medical term may be halitosis. Sometimes when you have this kind of halitosis or bad breath I'm talking about, it may be a sign of periodontitis. When the bacteria have access to the gum and the gum is destroyed one way or the other, you may be experiencing this kind of bad breath. Sometimes the tongue rotting may also cause this bad breath. When you don't brush your teeth, you leave this in your mouth for sometimes, you sleep with it, you wake up every day, poor mouth hygiene. You may also develop this kind of halitosis or a bad breath. It may be a sign of what? The periodontitis. You sometimes see pass between the teeth and the gum. Pass between the teeth and the gum when it's getting to the chronic stage of what? The periodontitis. This is also a sign of periodontitis. Pass between the teeth and the gum. Okay, and then loss of teeth or tooth loss. Most of the time, that is what we say, tooth loss. When you are there, sometimes you see that you begin to lose some of your teeth. You begin to feel some kind of pain in the teeth. You feel severe pain. Sometimes when you chew either meat, fruits, whatever you chew, either granite, whatever that you chew, you feel pain within the gum. You feel pain in the teeth. It's a sign of periodontitis. Okay, and then you see a time will come, you see like there's new spaces developing, like the natural spaces that most at time we have, most of us have. It's not like that. You don't have this kind of space within a point in time, but now you see that you begin to develop some spaces between the teeth or between the gum and the teeth. When you brush your teeth, there's profuse bleeding. It's a sign of periodontitis. Okay, I want to talk about some causes. Most of the time, we don't know this is the cause of periodontitis. When the plaque build up on your teeth, when I talk about plaque, sometimes you see some yellowish substance building up on the teeth or the bases of the teeth where the gum connected the teeth. You see a plaque buildup, some materials yellowish or brownish. You will see it there. That is what we call the plaque. So when the plaque build up and you ignore the mouth or oral hygiene, the bacteria may build up in this plaque, causing harm to the gum. So within a point in time, you begin to feel this inflammation in the gum or swelling in the gum. So a plaque that's build up. We eat sugar, we eat a lot of things, we eat some amount of carbohydrate and all that. And this plaque will build up. So whatever you've eaten, at least we have to brush our teeth twice daily to help do away with some amount of the plaque that build up. The plaque that build up on the teeth harbors the bacteria to cause harm to you as an individual. We also talk about poor oral hygiene. Poor oral hygiene may be a cause or a risk factor to periodontitis. Poor oral hygiene, meaning you don't brush your teeth at all or you don't brush your teeth very well. You may develop periodontitis or the gum disease. It's also a cause. So we, aside the plaque building up, we also talk about what? Poor oral hygiene. We also talk about smoking or chewing tobacco products. Smoking. When you smoke, some people, especially when you visit some areas, those who smoke very well, you see that the tartar build up on their teeth. So you see greenish, you see one person, you see different colors of teeth in the mouth. You see the plaque build up harbors this kind of dead suits from the smoking. So here you see that the tartar build up on their teeth. Green, 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 green. Yellow, 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 like that. So smoking may what? Trigger the periodontitis. Okay, smoking, aside the poor oral hygiene, smoking can also trigger the condition. We also talk about gingivitis, inflammation one way or the other. You have inflammation in the mouth, inflammation in the gum. It can also cause what? The periodontitis. And we also talk about inadequate nutrition. Inadequate nutrition, like you lack some amount of this nutrition, like example like vitamin C, that will help you one way or the other. So when you lack most of these nutrients, you have problem in the system as well, that may also trigger or risk the periodontitis. Okay, we also talk about certain medication that causes dry mouth. Certain medications that causes dry mouth may also trigger the condition periodontitis. Okay, and then we also talk about some conditions, a condition like leukemia, rheumatoid arthritis, etc., diabetes mellitus. These conditions can also trigger or are risk factors to what? Periodontitis. Okay, let me talk about some preventions. Then we end our lesson for today. Our next meeting we continue. Prevention, good oral hygiene. When I talk about good oral hygiene, when you want to prevent periodontitis, we have to keep practicing good oral hygiene. You brush your teeth at least twice daily. You brush your teeth at least twice daily. Good oral hygiene, and then regular dental visits. Regular dental visits. When you have problem with your teeth or you have this kind of inflammation in the teeth, or most of the time you have profuse bleeding when you brush your teeth, you see traces of blood in your saliva or whatever, please visit your dentist. So regular visits or dental visits will help you prevent the periodontitis. It's a chronic condition. Within a point in time, you're 30 years, 35 to 40, then you begin to lose your teeth. So regular dental visit. Okay, then we can also talk about avoid using your teeth as an opener. Most of us, when we go to the beach, our parties, and there's no opener, oh, don't waste my time, then we take the bottle, then we use our teeth, phew, then we open the drink. We should avoid that, please. We should avoid using our teeth as opener. It may what? Risk the condition, or it may affect your teeth. It may also cause what? Periodontitis. Okay, avoid smoking. Avoid smoking. Is one of the way to prevent periodontitis. And we also talk about limit high intake of sugar. Limit what? High intake of sugar. Is one way or the other we can prevent the periodontitis or gingivitis or gum disease. Good morning. The name still remain Romeo Gamet. Our next meeting we're going to talk about more. Thank you.